Harlequins has been sort of in partnership since we moved to Guildford. Obviously being locals, we used probably for the last 2-3 seasons now where we've been using all your products and then realised how big DJO actually is and probably been using it for forever because your walkers, the Aircast walkers we use, the knee braces we use, and then the main probably ones are the Compexes, which we obviously use loads of for rehabilitation through to recovery. In sport, you sort of have to stop things moving instantly to stop the bleeding as much as possible. So we'll put any knee injury at all, even if it's virtually nothing, just a bang, we'll put it in a knee brace, or if it's an ankle injury, do exactly the same just to try and stop the movement, which stops bleeding. A lot of the players get very frustrated that they come off the pitch and they're walking, and then within a minute I put them in a boot and they're in that for 24 hours to try and settle things down. So that's why we go through so many boots, is because get big feet in them for probably only 24 hours and then they come out of it and then we try and turn them around in a week. So very differently to how probably other sports or other professions in the NHS, we put it in for 6 weeks, we're putting it in for 24 hours just to clamp down the injury as much as possible, and then we start going at 24 hours post-injury. Compex to me has sort of 2 roles. One is in a recovery strategy, heavy legs or tired legs, or if after sort of tissue injuries, we'll put you on Compex to try and increase vascular return to speed that side of it up, or then it's more of an activation strength side, so all the way from day one post-surgery when things don't move as well as they should, all the way to getting them as strong and as fast as we want them back again. That ability to take the brain out of it and stimulate muscle to get them doing things sometimes that they're either bored to do or can't do. It's a really nice way to doing it, and Compex to me is the best way of using it. There's lots of other products out there, but Compex seems to be the best one. Can I come on? Good. The players love Compex just during it. They don't necessarily like it afterwards because obviously we get quite a lot of DOMs, sort of delayed soreness afterwards. But yeah, it's a nice way of them seeing improvement as well. And also they can use it without having to go to the gym, so they can do it at home. And if they're having to stay at home to keep things quiet, they can use, and they feel like they're improving all the time, so they really enjoy it. If we're in the gym wanting to do something a bit more ballistic, we'll definitely use the wireless aspect of it. And that's a great improvement from not having loads of wires. It just depends where you are in the rehab phase. If at the end the wireless one is used more, at the beginning we use the wired ones just because there's no reason to use the wireless one. Shockwave is obviously something that's coming into physiotherapy slowly, and it's starting to be the big buzzword that virtually everything that we get weird and wonderful, a consultant will say, try Shockwave on it, through from tendinopathies all the way through to acute injuries. We're starting to sort of have people sort of saying that it possibly can work. For me, it's a case of trying something, and that's the main thing we're using it for, is just trying it. If things aren't settling down, we can use it. We're probably using it at least 3 or 4 times a week with different players. Tendinopathy is not that bad. We don't tend to have tendinopathies here. We can sort of manage their load effectively and not stir things up. I remember last year we did have an tendinopathy because we signed someone from another club and we'd have loved it. Unfortunately, we've only had it for 12 months, so it'd be a nice addition from that aspect. And the main thing then is just soft tissue work, just tight muscles. It seems to be really good just by settling muscles down. Sometimes fingers, needles don't do quite as well, so that's our main aspect we're using it for. Obviously, it's quite sore on things, but they quite like being in pain. I think no pain, no gain, so they enjoy it. They enjoy using it, and sometimes just they want something a bit different. If they've had 3 different people look at it and try rubbing, it's another adjunct to physiotherapy that we try. I think of stealing it from Professor Tim Watson, but the wetter the better. Anything that's wet, anything that's acute, we put the Pulse Shortwave on. Just obviously in professional sport, we're being asked to do as much as we can from that, and it's something that in my undergraduate days we were told to use it and then never used it for about 5-10 years, and then all of a sudden had a good chat to Tim and said, what else can we be doing in that acute phase? You get that bleeding phase and there's not much you can do apart from rest and ice, whereas we're using it a lot now. Every player will be on it at least once a day, possibly 2 times a day. If we can spread enough time, bring the player in for long enough during the day, they'll be on it. So for any acute injury, it'd be soft tissue, it'd be jointy, they'll be on the shortwave to try and just settle down that inflammation phase. Has some real good effects with sort of hematoma, dead legs that wouldn't have turned around in the 5 days sometimes I'm given, and since having it we've managed to turn them around, so got any thumbs up for it. The players think it's a hairdryer and think it does absolutely nothing, and it's a good way of keeping them still, but we're happy. We're turning things around quicker, so that's a good thing.